Treatment of fungal nail infections are not instant, and it may take time. That's because it takes 4 to 6 months for fingernails to grow out completely and 12 to 18 months for toenails to grow out completely. With asymptomatic cases, no treatment could be an option because sometimes oral antifungal medications may cause unwanted side effects. Oral antifungals can be used to treat fungal nail infections, and these include the first one, which we're going to talk about today, which is Terbinifene, and this is often dosed at 250 milligram tablets, which are to be taken daily for 12 weeks if it's a toenail infection, and 6 weeks daily if it's a fingernail infection. There is a 50% cure rate for this medication, so there's no guarantee that taking the medication will cure the fungal nail infection. There is also a risk of liver toxicity. Itriconazole is another oral antifungal, and for toenail infections, 200 milligrams daily for 12 weeks is often prescribed. If it's a fingernail infection, the dosage protocol is a bit different. It's done in 2 stages, where for 7 days, 200 milligrams is given daily, and then it's stopped for 3 weeks. So no medication for 3 weeks, and then after that, another 7 days of 200 milligrams daily. Now, itriconazole has a 40% cure rate, and this drug should not be given to those with ventricular dysfunction or heart-related issues like congestive heart failure. There's also a risk of liver toxicity with itriconazole. In milder cases, cyclopyrox olamine, which is a nail lacquer, can be applied to the affected nails for 6 to 12 months. This lacquer can be used alongside the oral antifungal medication to increase their efficiency. The first sign that the medication is working is the appearance of a normal nail plate growth from the proximal nail fold region, which can potentially be seen within the first few months. A final treatment option could also be physical removal of the affected nail plates, and this could be combined with oral or topical therapy. Finally, to end the video, here are 5 tips to avoid getting fungal nail infections. The first tip is if you do have athlete's foot or some kind of fungal foot infection, it's really important to treat it as soon as possible. Athlete's foot in general is quite common, so treating it as soon as possible can help avoid the fungus invading the nails and causing onychomycosis. The second is to keep your feet clean and dry as often as possible. Wear clean and dry socks every day. That's the third tip. The fourth tip is if you're in a communal shower or a pool area, wear flip-flops or sliders. Don't go around barefoot. And the final tip, which is the 5th tip, is don't wear old or tight shoes because you're at higher risk of causing trauma to the nails, and therefore it can result in infection of the nails.